Hello, my name is Holly Precker, and this is an assignment for my psychopharmacology class. It's an assessment on Maria, a 35-year-old female, married over 10 years, has 2 children, is a assistant principal of a middle school. She, her presenting problem is that she is feeling kind of blah in her life. She's under a lot of stress with her job. She has a lot of things that she goes through, but she is just struggling for her day-to-day operations. She struggles to get out of bed. She's gained weight. She feels she's got low self-esteem. She is just having a hard time going through the daily motions, and it's just been a struggle for her. She's been experiencing this for 3 weeks. She did say she's had a history of this in the past when she was in high school when a breakup from a boyfriend, and in college she had a hard time getting out of bed for a week, and it was because balancing of stress of her job and school. Upon her initial assessment when she came in, we had her do a DOS inventory, and so we looked at her depression, anxiety, and stress, and her anxiety was in the normal range at 3, stress was at a 14, and it was mild, and then depression ranked a 37, which was an extremely severe. What was surprising about this is that her stress was, in a pretty mild, normal range, that's not bad, but then her depression was severely high. So looking at that, I kind of wanted to look at some different things on trying to help her out by doing like a biological assessment. I would recommend that she would visit her primary care physician and just get checked out for any issues such as thyroid, hormonal imbalance, diabetes. Is she currently on any kind of medications that could cause this depression side effect? The other thing that I want to look at is psychological. What's going on? Has there been any major things happening? A car accident with possible head injuries? That kind of goes more on the biological, but has something major happened? A death of a parent? Anything like that? Also looking at psychological, I want to focus a little bit more about what's going on with her. How long has she been in her position at the job? Is it a new job? Has that triggered what happened basically kind of 3 weeks ago that maybe might have triggered something? The other thing too, with social assessment, looking at her relationships with her husband, her children, parents, siblings, relationships with coworkers, looking at kind of all aspects. Also spiritual assessment. She identifies as being a Christian. Her family's heavy into going to church. How has that helped or hindered her? What's inspiring her? Just to kind of get more understanding of who she is, how she thinks, kind of what's going on in her head, what are her thoughts, especially the suicide ideation. Just kind of see when she's saying that she wants to get away from it all, what does that really mean? Is it that she just kind of wants to leave her life, like physically leave her life, or is it, she just wants it all to end? Just kind of see the severity of that. The other thing, so when she goes to the primary care physician, I would assume he might recommend a selective serotonin reuptake inhibitor, SSRIs. And so the first one I would think that he might recommend possibly would be Prozac, the fluoxetine, along with some other ones, just to kind of see maybe a smaller dose, not a smaller dose of it, but also to partner it up with psychotherapy, because this has happened in the past, and it doesn't sound like she had therapy in the past to in addition to the medication. I think that might be beneficial for her. And part of that, I would see, we would work through narrative therapy, because I think she's got a story that she needs to tell and kind of go through some things that have gone on maybe in her life that maybe she hasn't dealt with. Maybe she didn't deal with a breakup from back in high school. Maybe it's the balancing of, her job and family stresses and pressures. So we kind of want to explore that. Also, I want to work with her coping skills on how she can balance everything out. What she can do, how she can problem solve some of her things that are coming up that's causing her stress. Also, I want to look at self-care exercises, things that can help her, like possibly, like she had mentioned she loved to run, maybe getting back into that exercise again, of course, if her physician lets her do that. And then also a little bit of CBT, the cognitive behavioral therapy, addressing negative thoughts, kind of, does she have any negative thoughts that's plaguing her, that's pushing her down? But mostly I see it's the balancing of the stresses in her life. Even though stress didn't rank high, that's kind of something that I see. But again, we want to double check and rule out the biological things just to make sure it's not something hormonal, since she has been craving sugars and carbs. Also, maybe possibly a meeting with a nutritionist just to kind of talk about things to help her eat healthy and be at her optimal healthy self. How many sessions I would think? I would say once a week for once a week for 6 weeks, and then once every 2 weeks for the next 6 weeks, just to kind of see how that balances out. If she needs it more, then we can increase it. If she needs it less, then we can adjust it depending on how she's doing. And as far as prognosis, during her in her initial assessment, she seemed like she wanted to help. She wanted to be helped. She didn't come reluctantly. She feels that she feels like she's letting kind of her family and work down. That's why she wants to be here. She wants to be better. So I anticipate that she will get better and over time know how to deal with these stresses as they come up. And so it looks pretty good. And that is all. Thanks.